African horse sickness and equine encephalosis. For African horse sickness, the occurrence, so it began in Africa and then it spread to Turkey, Iran and Iraq. It's now found in Portugal and Spain. For the etiology, so the Cetorrheoviridae has the orbivirus genus, which has the African horse sickness virus. It has 9 serotypes. It's a double-stranded RNA virus and it's non-enveloped, which is unique because reoviruses are normally resistant, but the orbivirus is sensitive, and they're arboviruses, so they're spread by mosquitoes. It has a segmented genome, which is important because it allows genetic reassortment. And they have a double capsid, so they can hide nucleic acid. For the epidemiology, they're arboviruses, so they're spread by midges, which are culicoides, and culicidae, which are mosquitoes. Culicoides are biological vectors, and culicidae, which are mosquitoes, are mechanical vectors. It's a urixin virus, and it can infect horses, donkeys, and zebra. They're all susceptible. It can also be found in dogs, ferrets, camels, and elephants. Horses have an extremely high mortality, whereas zebras are asymptomatic. They're carriers, and the disease has a longer viremia, so around 28 days, and it's in a milder form, whereas the horse has viremia for only a week, and then it dies. Zebras and donkeys are reservoirs for the disease. For the pathogenesis, midges inoculate the virus into the horse, and then the primary replication happens in the lymphatic tissue, and then viremia occurs, and it spreads and causes damage to endothelium, which causes edema and hemorrhages. The virus can then spread to the heart, and this reduces oxygen circulation, which causes respiratory problems in the lungs. For the clinical signs, there are 5 clinical forms. There's peracute, the pulmonic form, the acute form, the subacute cardiac form, the mixed form, and the chronic form. In the peracute pulmonic form, death occurs within 24 hours. They get pulmonary edema, and you can see foamy nasal discharge. In the acute form, death occurs within 1 week. They get edema and show respiratory signs. The subacute form is the most frequent form. It's also called the cardiac form or the edematic form. So in the subacute form, we can see fever, dyspnea, hemorrhages on the conjunctiva and the ventral side of the tongue, and foamy nasal discharge. And they can get suffocation due circulation failure. And they also get hippopotamus head, which is severe edema in the head, and the animal usually dies from cardiac failure. But if the animal survives, the edema goes away. The 4th form is the mixed form. We can see respiratory signs and cardiac signs and edema. And in the chronic form, it's febrile. It affects donkeys and zebras, because donkeys have a 10% mortality and zebras have a 0% mortality. They can experience reoccurring fever, and they have a reservoir role in the spread of the virus. Horses can have a 96% mortality, mules have a 50% mortality, donkeys have a 10% mortality, and zebras have a 0% mortality. And this disease does not cause abortion. In the pathology, we can see blood vessel damages, so edema, hemorrhages on the conjunctiva and oral cavity, and we can see hydrothorax and pulmonary edema, so we can see foamy content in the airways. We can also see epicardial and endocardial hemorrhages. For the diagnosis, it's a notifiable disease. It can be detected with epidemiology, clinical signs, and the postmortem lesions. To detect the virus directly, we do a real-time PCR, and to detect the virus indirectly, we do ELISA. We can also do AGIT and viral neutralization. For the isolation, the virus can be isolated in the brain of a suckling mouse. The differential diagnosis can be equine viral arteritis, but this has abortions, and African horse sickness does not. And it can be also anthrax, except this is milder respiratory signs. For prevention, so in countries that are free of African horse sickness, you need to prevent the introduction through having quarantine and serological tests, and do not import from endemic areas. Control midges, and since dogs are carriers, they can be tested for it, and separate zebras, donkeys, and horses. If zebras are imported into a country, they can infect the entire country, so you need to have a close quarantine and they need to be tested. In the case of an outbreak, the legal restrictions need to be followed. So restrict movement, have a restriction zone, a protection zone, and a surveillance zone. And there's also an inactivated emergency vaccine. And in endemic areas, just control midges, and there's also a polyvalent attenuated vaccine. For equine encephalosis, this is a milder form of African horse sickness. It occurs in South Africa, but there was an outbreak in Israel in 2009. For the etiology of the disease, we have the Cetorrheoviridae, which has the orbivirus genus, which has the equine encephalosis virus. It has the exact same etiology as the African horse sickness virus. For the epidemiology, it's the same as well. So arboviruses, so the virus is spread by coolicoids, midges, they're biological vectors. Horses are more susceptible than donkeys, and the zebra are the least susceptible. For the pathogenesis, midges inoculate the virus into the animal, then the primary replication happens in the lymphatic tissue, and then viremia occurs, and it spreads and causes damage to the endothelium, which causes edema and hemorrhages. It can infect the heart, which decreases oxygen circulation, which also causes respiratory problems. But for the clinical signs, this is where it's different. So it can infect horses, but donkeys and mules are asymptomatic. In the same as African horse sickness, we can see edema in the head, lips, and eyes, so they experience hippo head. But they also get central nervous system signs, so they can get brain edema, which can cause ataxia, circling, and solemnness. And equine encephalosis also causes abortion. It's a fetopathogen, but African horse sickness is not. It does not cause abortion. Also, the recovery is 1 to 3 weeks. It's rarely fatal. In the pathology, we can see blood vessel damages, and for the diagnosis, you can follow the epidemiology, clinical signs, post-mortem, and you can also do PCR. To detect the virus directly, you do a real-time PCR, and to detect the virus indirectly, you do ELISA. These laboratory exams are needed due to the similarity to African horse sickness. For prevention, just follow the general epidemiological rules, and there's no vaccine. There's no vaccine because most horses recover from equine encephalosis, but not from African horse sickness.